Welcome everyone and good afternoon. Today we will delve into the important and complex topic of shortness of breath, also known as dyspnea. This symptom is one of the most common and challenging complaints encountered in medical practice, impacting patients across a wide range of conditions. Our goal is to provide a comprehensive overview, exploring the underlying causes, diagnostic approaches, and management strategies to enhance our understanding and improve patient outcomes. Let's embark on this journey together, integrating current knowledge with the practical insight. If you have questions, please post them in the comment section below. And if you are new to my channel, I will request you to please subscribe to this channel and press the bell icon for future updates. So what is shortness of breath? Shortness of breath, medically termed dyspnea, is the sensation of difficult or uncomfortable breathing. It can manifest as a subjective experience where individuals feel they cannot get enough air or need to exert more effort to breathe. This symptom can arise suddenly or develop gradually over time, and it may be associated with a wide range of underlying health conditions. Shortness of breath can be indicative of issues in the respiratory system, cardiovascular system, or other systemic problems, as we are going to discuss them one by one in the coming slides. Its severity can vary from mild and temporary to severe and persistent, significantly impacting an individual's quality of life. Also remember that there are some very subtle causes of shortness of breath that are not life-threatening and can be ignored. Okay, so first let's talk about definition and symptoms of shortness of breath. A patient with shortness of breath can present with feeling of suffocation. Shortness of breath may be accompanied by a sensation of suffocation, making it challenging to perform routine activities, or the patient may be presenting with labored breathing. They may experience shallow or difficult breathing, often resulting in distress and anxiety, and there may be visible symptoms like wheezing, coughing, chest tightness, and bluish discoloration of the lips and skin. So this is how the patient can perceive and present to you. And this presentation is very important because it gives you clue to the underlying possible cause of shortness of breath. Talking about the common causes of shortness of breath, we can classify the causes of shortness of breath and classify them on the basis of their severity into acute or chronic presentation, or just from the common causes to the more severe causes. First, let's talk about the common causes, and the most important cause that should be remembered is asthma, which is a chronic respiratory condition characterized by airway inflammation, bronchospasm, and recurrent episode of breathlessness. Pneumonia is an infection that inflames the air sacs in one or both lungs, causing cough, fever, and difficulty in breathing. And anemia, which is a condition where there is a lack of healthy red blood cells or hemoglobin, resulting in reduced oxygen flow to the body. These are the common causes of shortness of breath, but the more life-threatening causes that requires further assessment and vigilant approach are those arising from the respiratory and cardiac systems. The respiratory causes of shortness of breath are pulmonary embolism, which is a sudden blockage in lung artery, typically caused by a blood clot, leading to sharp chest pain and difficulty in breathing. And the second important cause is pneumothorax, a collapsed lung, often due to injury or underlying lung disease, resulting in sudden sharp chest pain and shortness of breath. And chronic obstructive pulmonary diseases, a group of lung conditions uh, that are divided into chronic bronchitis and emphysema. They make it difficult to breathe, and these are progressive conditions. Without treatment, they progress and the symptoms get worse over time. And the cardiac causes of shortness of breath are, the topmost is heart failure, which is a condition where the heart is unable to pump enough blood to meet the body's needs, leading to fluid buildup in the lungs, interstitial spaces, and the patient gets a sensation of choking, air hunger, inability to sleep and lie down, or may have other symptoms associated with shortness of breath, for example, pedal edema, the swelling of feet, etc. Arrhythmias, which are abnormal heart rhythms that can cause the heart to pump less effectively, resulting in inadequate blood flow and shortness of breath. Coronary artery disease is narrowing of the heart's blood vessels by plaque buildup. The epicardial coronary arteries are narrowed and they are inability to supply enough oxygen to the heart muscles. Usually the symptoms of the coronary artery disease are chest pain, but some patients may present with shortness of breath instead. So if a patient is likely to have coronary artery disease based on their risk profile, they don't have chest pain and they have shortness of breath, so they should be evaluated for further management. Other medical conditions can also cause shortness of breath. Anxiety disorders are very important. In particular, patients with panic disorders and generalized anxiety disorders can present with shortness of breath and hyperventilation. Obesity is another cause of shortness of breath because the excess weight can put pressure on the diaphragm and lungs, leading to reduced lung function and difficulty in breathing. And finally, anaphylaxis, which is a severe allergic reaction that can cause airway constriction, swelling, and a sudden drop in blood pressure, leading to breathing difficulties. These are some other important medical conditions apart from the cardiac and respiratory causes, and they are obviously very important. Apart from the medical conditions that we have already discussed, lifestyle factor can also contribute to shortness of breath, and the most important among them is cigarette smoking. Tobacco smoke can inflame and narrow lung airways, leading to chronic respiratory conditions and reduced lung function. Smoking also contributes to coronary artery disease, which can also present with shortness of breath. Sedentary lifestyle, which is physical inactivity. This can weaken respiratory muscles and reduce lung efficiency, leading to breathlessness during exertion. And pollution. Exposure to air pollution, environmental toxins can impact lung health, contributing to shortness of breath and respiratory issues. After you have clinically assessed the patient, the next step is to perform certain diagnostic tests for identifying the cause of shortness of breath, and these are easily available tests should be performed first before moving on for more advanced investigations. The first test is chest X-ray, which provides an image of the heart, lungs, and other structures to identify abnormalities. Pulmonary function tests measure lung capacity and function, helping to diagnose conditions such as asthma and chronic obstructive pulmonary diseases and interstitial lung diseases as well. Echocardiogram uses sound waves or ultrasound to create moving picture of the heart, helping to assess the structure and function of the heart, and it gives you important information about heart failure, about valvular heart diseases, and about coronary artery disease. So these three tests should be performed initially, and they should be a part of your routine evaluation for a patient who presents with shortness of breath of undetermined etiology. As far as the treatment options for shortness of breath are concerned, always remember that treatment of the underlying cause is the most important aspect of management. You have to identify the cause of shortness of breath and treat it accordingly. However, certain general principles can be applied, and these are that the use of certain medications. For example, if a patient has asthma or chronic obstructive pulmonary disease, these patients can benefit from bronchodilators or corticosteroids. Patients from anxiety can benefit from anxiolytics and SSRIs. Patients from anemia improve with the treatment of their anemia. Patient with heart failure requires guideline-directed medical therapy, and so on and so forth. So identify the cause and treat it accordingly. The role of pulmonary and cardiac rehabilitation is very vital for patients who have chronic lung diseases and heart failure. And this is a program that includes exercise, education, and support to improve lung and heart functions and overall well-being. In certain selected patients with chronic obstructive pulmonary disease, oxygen therapy, long-term oxygen therapy, home oxygen therapy, for severe cases, they can improve oxygen levels in the blood. So the key takeaways are that seek medical evaluation. If experiencing persistent or severe shortness of breath, it is crucial to seek professional medical evaluation and care. Also emphasize on the prevention, addressing underlying health conditions, maintaining a healthy lifestyle, and avoiding environmental triggers can help prevent breathlessness. And support and education. Education about self-management and access to support groups can empower individuals with tools to manage and cope with breathlessness. Okay, so these are the key takeaways, and this is a brief overview of shortness of breath. Uh, Thank you so much for joining me. If you have any questions, please post them in the comment section and I will try to answer them. Till our next presentation, goodbye.